It is March 27th, and the first week of full-time treatment has been a rough one. I started radiation on Monday. Sunday and most of Monday I spent in the ER with problems breathing. The conclusion they came to was that I was having a sudden inflammatory response to the cancer in my lungs. She said it wasn't uncommon for that to happen to patients at some point. So they gave me an inhaler and sent me home late Monday afternoon. So I had my first radiation treatment while I was still admitted, and it seemed to go fine. I don't really feel anything during a radiation treatment. I usually feel pretty wiped afterward and need to sleep for a few hours. I kind of wanted to show you what that machine looked like and what it looks like when you're in it to get treatment. So here is some of that. So yeah, the radiation has been going fairly well. One thing the doctor told me was that as this one site gets treated, I may become aware of other sites may start to become more painful. And that has definitely been the case. Right now it's the ribs on my right side, and my sacrum has been pretty tender since Wednesday. So he said if it continues to be those two spots, starting Tuesday of next week, we're probably going to treat those areas, one of those areas next. So we'll see. Okay, so chemo has not been going so well. I am taking Xelata, and you might see on here it says stop taking if any of these symptoms start happening. So Wednesday night, I started getting two of the symptoms. I started having the pain and swelling in my feet, and they were like red, like the soles of my feet were like bright red. And then I started throwing up. Like, it says it's okay if you throw up once every 24 hours, but I was like consistently throwing up every few hours. So, and this was pretty late in the evening, so I took a bunch of medication to knock myself out, went to bed. The next morning I got up and I did all my pre-medication for nausea and all that other stuff. And I called my doctor and told her what had happened the night before, and told her I really didn't want to take the Xelata that morning because I was still feeling really bad. She told me to stop taking it immediately, and that it looked like the Xelata wasn't going to work for me. So she wanted me to focus on getting down as much fluids and any food I can over the next 4 days. I'm supposed to meet with her again on Monday, and it looks like we're going to have to change to a different chemotherapy because this one's it's too much on my digestive system. In the last 5 days I've lost 10 pounds. So that gives you an idea of how it's pretty intense. Today I was having a really rough day again, and I called her because it's been, geez, I haven't taken any since Wednesday night, and I'm still, all day today, I threw up like 6 times. I could not quit throwing up, and I don't even know why. They said sometimes radiation will do that to you, but she said you haven't been doing radiation long enough. It shouldn't be the radiation right now, so it's probably still the Xelata in your system. So I've pretty much got that under control now. I'm feeling a lot better. I was able to get down some applesauce and a few popsicles, and that's about it. So I got to try and build back up and get some more food down because it's just bad news bears right now. She hasn't told me exactly what she's planning to change it to, but it sounds like it's going to be an intravenous chemotherapy, which I really didn't want to do, but if I can't keep it down, then I don't really have a choice, right? So we're supposed to meet with her, like I said, Monday. go over, what's going on. I'm supposed to get my body weight in and do some blood work and see how my immune system's being affected. And then I have time scheduled for treatment center. So the treatment center is where you go when you have intravenous chemotherapy done. So I don't have a port right now, but I may end up getting one if it turns out that I have to have intravenous chemo again regularly. Just for convenience sake, it's also a lot easier in emergencies too. If I have a really bad reaction, they can hit me with Benadryl really fast, and they don't have to, try and start an IV. If I get really dehydrated, it's hard for them to start an IV. If I have a port, they can just plug me into fluids. So it's easier to manage all that stuff when you have a portacath. So I may end up getting that again. I don't know for sure yet. So that's where we are right now. Like I said, it's been a rough week, but I'm feeling better now. I don't have any radiation for the weekend, so today was my last day for this week, and then I get a break for a couple days. And then I have 5 days scheduled for next week, Monday through Friday. They're going to finish up the radiation on my low back and possibly start another site at the same time. Each treatment takes about, I'm in the room and on the table with the machine for maybe 10 minutes, but the actual treatment of radiation is like 30 seconds at a time. So they treat your spine from one direction, from the front, for 30 seconds, and then the machine does this big swoop under, so the big round thing is underneath you, and then it treats you for another 30 seconds. And I guess the way it works is there's 2 lasers that actually go through your body, and it only does radiation at that intersection. So where those lasers cross is where it's actually doing the treatment. So it's kind of amazing how precise they've gotten this, and yeah, I've definitely noticed a difference in at least my low back. In that area in my lumbar spine doesn't hurt nearly as much. But yeah, I guess I will let you all know what chemo I'm going to be switched on, and I'll keep you posted.